Hello. So today we are doing an abdomen assessment, and I have Carmen here. She's volunteered to be my patient. Carmen, do you agree to be my patient, and do you allow me to show this video to my school for education purposes?
Yes.
How old are you?
50.
So Carmen is over 18, and she's allowing me to do this. So we're gonna go ahead and move right into the abdomen assessment. We're gonna go ahead and start with the inspection. So I'm gonna be observing my client's abdomen for contour, which is pretty much a fancy word for shape. Symmetry, color, any lesions, scars, veins, any surgical scars, any hair distinction. I'm going to be looking at her umbilicus. And starting off, I'm observing and the contour and shape looks flat. So my patient has a flat abdomen. Symmetry on both sides are equal when client breathes on both sides. The color is, she has an even tone, no cyanosis or jaundice or any bruising that I could see when observing her abdomen. She doesn't seem to have any dilated veins. I do see that she has a surgical scar here. Did you have a
umbilical hernia?
Okay.
Remove.
So she's stating that she had a umbilical hernia that was removed, and I could see that she has a scar in the umbilicus area. So her hair distribution, she has none. So I guess she doesn't have any, or it's even. And then her umbilicus, it's midline, it's inverted, and there's no inflammation or discharge. Carmen, are you experiencing any abdominal pain?
No.
Okay, good. So she's not experiencing any abdominal pain, but if she was to say that she was, in fact, experiencing any abdominal pain, I would, of course, ask her, what makes the pain worse? What makes it better? I'd have her describe the pain, if it's dual, sharp, if it burns. I would also ask her to show me where it is. And if it, I would also ask her the rate of the pain from 0 to 10, 10 being the worst pain she's ever felt. I would ask her, when did it start, how long, and what she thought it was causing it. But in this case, she says she doesn't have any abdomen pain. So we're going to go ahead and move to auscultating. I'm going to be auscultating her abdomen, which is, I'm going to be listening to all 4 quadrants: right quadrant, left quadrant, right lower quadrant, and left lower quadrant. I'm going to be listening to for at least 1 minute on all quadrants to hear any bowel sounds. And what I'm going to be looking for is any gargling occurring every 5 to 30 seconds. And so we'll start with that. I'm going to go ahead and start on the right lower quadrant, and then move up to the right upper quadrant, then to the left upper quadrant, and down to the left lower quadrant. And this is pretty much broken down into 4 quadrants. Okay, if I didn't last a minute per quadrant, just due to the nature of the video, but you would listen for at least a minute on each quadrant. From what I heard, my client has normal bowel sounds, and they are occurring every 5 to 30 seconds. Now, I'm gonna ask Carmen for her bowel patterns. Carmen, how often do you have a bowel movement?
Once a day, at least.
Once a day? Good. Have you ever noticed any changes like diarrhea, constipation, or blood lately?
No.
No? Good. What about digestive systems? Have you ever had any trouble swallowing?
No.
Any gas?
No.
Heartburn?
No.
Cramping?
No.
Nausea?
No.
Vomiting?
No.
All right. So now I'm going to be percussing all 4 abdomen quadrants. I'm going to be listening for tympani all over the quadrants. So for this, I'm going to start again on the right lower quadrant, and I'm going to be percussing. So I'm going to be tapping. I'm just listening for any tympanic sound. Okay, Carmen?
Okay.
All right. So I did hear tympani sounds all over the quadrants, which it's a normal finding. Now I'm going to palpate all 9 quadrants in the region. I'm going to go ahead and palpate. I'm going to first do light palpation, and this is just me looking for any guarding or any rigidity, and then I'll be doing the deep palpation, which is assessing for enlarged organs. Carmen, are you having any pain anywhere?
No.
Right now? Okay. So I'll go ahead and start with the light palpation, and this is going to be all over the 9 quadrants. So you're going to feel me pressing. And I'm just pressing about 1 centimeter deep for the light palpation. So now I'm going to do the deep palpation, and this is anywhere from 5 to 8 centimeters deep. And once again, I'm just assessing for any enlargement of organs. So now I'm going to be pressing a little deeper. Okay, let me know if you feel any pain. All right, so her abdomen is soft, non-tender. I didn't feel any masses, so that's a good normal thing. Now I'm gonna be I'm gonna be palpating the bladder, just to see what for the assessment. So the bladder is around this area, so I'm going to be pressing.
Okay.
Just going to be feeling. All right, so it's non-palpable when empty. And this concludes my assessment of the abdomen. Thank you, Carmen, for helping me out.
Thank you.